I'm mentioning all these conditions because all of them have an associated complaint of fatigue. Rheumatoid, ankylosing spondylitis, all the patients who have active inflammation invariably will have some degree of fatigue. And as we treat them and as the patients get better, the fatigue usually improves. As Dr. Kaplan was saying, it's hard sometimes to say how much of the fatigue relates to the physical condition, the one we can see, the inflammation, the swelling, and how much of it is secondary to the depression or the stress or the whatever is affecting the mind of patients who have chronic pain or chronic conditions. You cannot separate the brain or the mind from the body. It's very hard. People who have arthritis are frequently depressed. It's not fun living with pain every day of your life. So the symptom of fatigue can be related to that emotional stress or depression that affects people with chronic arthritis, but also to the inflammatory part of it. And we try to determine that because the treatment is different. We don't want to over-treat the inflammatory part or the arthritis when in fact the patient may be referring to their fatigue mostly because they are depressed or because of other conditions. And then there's a group of disorders that rheumatologists see that are not osteoarthritis, which is the wear and tear type of arthritis that I mentioned in the beginning, or the inflammatory type of arthritis, rheumatoid, lupus, etc. But it's a form of what we call soft tissue rheumatic diseases, and that's fibromyalgia. And everybody, fibromyalgia is a very common problem.